If you have a child who's either chronically ill or deals with a lot of tests, I have a tip. My 7th son, who's 9 years old, has been dealing with kidney issues since he was 5, and he was recently diagnosed with stage 1 kidney disease. For the past 4 years, he has been through a battery of tests, and we are now going for blood work again. I didn't know how to navigate any of this or how to be able to make this at least better for him, so here's some of the tips that I do, especially when it comes to tests. The biggest thing that I do is I'm very, very honest. If you're going for blood work, you're going to feel a little prick when it goes in. It is not going to be painless. You are going to be able to feel it, but it's okay because I will be right here. I see a lot of parents tell their kids that it's not going to hurt when it is going to hurt, and then their kids are not going to believe them the next time that something actually hurts. Now, fortunately for my son, there's a lot of tests that he has that do not hurt, like urine flow streams or ultrasounds. So I can be very honest. Yes, this is going to hurt. No, that's not going to hurt, because he has a fair share that do not hurt. However, for the ones that hurt, I'm honest. One of the things that I do, no matter what the test is there's some kind of little reward afterwards. A lot of the times it's something out of the gift shop at the hospital, like a little stuffed animal, and he has a whole collection of stuffed animals, especially the wormies, which are the ones that are like you can microwave them and they're cuddly. He loves those. Although I accidentally microwaved a turtle for a little bit too long, fried the whole thing. It was a weird day, but I replaced it. If it's an outpatient test that's not at the hospital, usually we go and get a Lego set. Recently, he ended up having a UTI. We had to go to the ER, and he was in a lot of fear that day. He did not want to go into the ER. He didn't know what to expect. Usually we have a lot of time to prepare ahead of time, and he was really resistant to going into the hospital. It took like a good hour of being in the hospital and me being like, all right, I'm leaving you, and walking away, and then him not following. And I'm like, wait, you always follow. That's not working anymore. Take on it. Finally, I bribed the kid with a Lego set. That's how we got in the hospital. And we had to go in through a different door because we had to go in and check something in there, and then we walked the back way to the ER. Just want to throw that story out because it's not always sunshine and roses. It doesn't always work. Sometimes there's days that they just don't want to be a kid with a sickness. And in order to make sure that he realizes he's always in control of himself and his body to the best of his ability, and he has to respond to what his body needs, today we were actually making an appointment for him to get blood work. Blood work is never fun because you have to get poked, and he knows that that's going to hurt. However, I gave him as many choices as I could so that he could still feel in control. I was setting up the appointment online, so we were going through the different times, and since he has to fast for it, so I'm making him aware that he has to fast for it, that, these are the different times. Do you think you'll be too hungry then? Do you think you want to wait for another day where you won't be as hungry and we can get an earlier appointment? And in setting the appointment, I was going over all the details of what that appointment is going to entail, that you are going to have to pee in a cup, you are going to have to get blood taken, you are going to have to fast, and then we chose from different dates and times to be able to figure out when he wanted to go. I gave him that control. Kids, especially little kids, because he's been dealing with this since he was 5, can feel really out of control because they're just being told by adults where to go, what to do, and what happens next. Any time that you can put control back into their hands is beneficial. And I've learned that not only from the child life specialist at the hospital, but also just from the great practitioners in general that we have out at the hospital. They're typically informative of this, what's going to happen next. Now we're going to go here. Now you're going to go talk to this person. If you look at this on screen, this is your left kidney. If you look at this on screen, this is your right kidney, so on and so forth. Now he's not as scared about his tests, though he is still a little bit nervous, but he does feel like he's in control. I try to always speak in authority, that he is a person, he's not his condition. I do not like titles, I do not like diagnoses. No matter what you're dealing with, you are you. A diagnosis is something that you have to deal with, it is not you. I try to always separate for him the difference between him and any diagnosis that he's facing, while also keeping it real that this is something he's going to have to deal with forever. Lord willing, never progressing past stage 1. And just like all things in parenting, I'm giving him the tools to put into his toolbox how he's going to be able to navigate his health for the rest of his life. This is how he's going to be able to face it. I'm helping him sculpt that at this point, to know there are going to be tests that are uncomfortable. There are going to be other things that are not uncomfortable. And that it's okay to face things that are going to hurt sometimes if it's going to better you. The reason I bring all of this up is because I hear so often, especially from phlebotomists, that a lot of parents tell their kids that it's not going to hurt when they get blood taken, or it's just going to be a little bit and it's not anything severe. You have to be honest, it's going to hurt. I remember when I took one of my daughters to get her ears pierced, she said, is this going to hurt? And I said, you're about to be stabbed through your ear with a needle. What do you think? Like, of course it's going to hurt. However, it's something that you want done. So can you deal with the pain? Yes. Okay, cool. And then we moved on. And the lady was like, everyone's just like, it's fine. Don't worry about it. It's okay. Like, you're being stabbed on purpose. That's not just going to be okay. It's like saying a tattoo tickles. So if your kids are dealing with any kind of different health issue or mental health issue, make sure that they're involved in the care and treatment, and it's not just around them happening, or it's just things that happen to them, but it has them involved in the entire process to the best of your ability. Informed consent matters, and that happens from a very young age. These are all the things that could potentially happen. You need to be able to understand because it's your body. Informed consent to the best of their ability is something that's very legitimate. It's also teaching them that they are in control of their body, that they do have the control on what happens to them, and that them consenting to it is important and required in order to be able to get the best care. That feeling of powerlessness can wear on kids. I mean, we know that it wears on adults when we feel out of control. So even if you don't think they understand, explain it to them the best that they can. I hope none of those tips ever come in handy, but if they do, hopefully they help.